Welcome back to Kato Living. Community Matters, helping Madelia Health and getting the word out about their services provided to southern Minnesota. We're joined by Dave. Thank you so much for joining us. All right, tell us about Madelia Health.
Well, we're a critical access hospital located in Madelia Health. So we have 25 beds, and then we have 5 clinics now in and around Madelia. So we're a nonprofit hospital, small, but yet high quality of care and great practitioners and caregivers all around.
Yeah.
So, yeah.
What does it mean to that community to have a healthcare system right there in their community?
Well, you know, it's the motto of, family taking care of family, in some cases literally, neighbors taking care of neighbors. And what it means to the community is employment for a lot of people that live in and around Madelia. And get to know your practitioners in and about the Madelia, going out to dinner and you can see your caregivers. It's pretty special.
That's awesome. Okay, so we know that the healthcare in southern Minnesota has changed a lot in the last 5 years, but Madelia has been a stable point. What does that mean to you and maybe to that community, knowing that you guys have been there and continue to be there? Yeah,
we just celebrated 100 years not long ago, and you know, a staple of Madelia. And what it means to us is really providing health care locally so people don't have to travel to Mankato, Rochester, Twin Cities, right? Get care closer to home, get people well enough and strong enough to go back home safely.
Yeah.
Explain what it means to be a nonprofit healthcare provider and kind of what that means to you guys and then what it means to the community.
Yeah, so being a nonprofit, we have some responsibilities that we have to do and perform. We give back. We utilize charity care is one thing. So people can't afford it. They don't have to stress about it. We can then, hopefully write some of that off, and there's an application for that. Outside of that, being a nonprofit, we've got to give back. Our caregivers, they volunteer. We clean ditches. We do all those type of things, and just trying to be involved in the community as much as possible.
I like that a lot. Cool. Okay, so as people go through phases of their life, whether it be maybe young adults like Matea and I, or getting up there in age when you become a senior, what pieces of advice would you give to those people throughout their life?
Yeah, I mean, we're blessed with a lot of great healthcare organizations in and around both southern Minnesota and in Minnesota in general. And so, go to a practitioner that you can relate to and early and hopefully, keep going back in that relationship. They get to know you and it's really, we're trying to put the health back in healthcare. And so rather than, reimbursement is still set up as sick care. So you get sick, you come and see us. We really want to be on the front end. There's less reimbursement on that, but I think that's what we owe it to the people that come to us to make sure that they stay healthy and live live a more healthy life.
Yeah, really cool. Any hopes and goals for 2026?
Well, we just started another clinic in New Ulm, and so that's our fifth location. So we're in Truman and Lake Crystal, St. James, obviously in Madelia, and now in New Ulm. And so outside of that, we would love to put a second OR on, operating room to provide those services closer to home. So that would be the biggest thing.
Yeah, continue to grow. Okay, if people wanted to find out information, see if they're able to go to you guys, how can they find out more?
Yeah, we're at MadeliaHealth.org. We're on Facebook, pretty much all the social media channels. And then we have a foundation as well. So if people are, want to give to Madelia Health, check out Madelia Health Foundation.
Okay, well, thank you very much. We appreciate it.
Thank you.
Still to come on Kato Living, closing out the Community Matters show with New Ulm Area Catholic Schools. We'll have more details after the break. Don't go anywhere.